This is Rick Mattson from the University of Washington Shoulder and Elbow Service. Let's talk a little bit about rehabilitating the shoulder. So shoulder rehabilitation needs to be individualized for each shoulder in each person. And it really depends on the specifics of the condition being treated and can only be determined by the physician that's treating the patient. So what we're showing here is just exercise that we use commonly in our practice just as a demonstration. But again, their application needs to be dictated by the person treating the individual patient. So we like to group them into two categories. There are exercises for shoulder stiffness, and as we'll see, there are exercises for shoulder weakness. Shoulder stiffness can be a challenge for patients after joint surgery, but it can also be challenges for patients who've not had surgery. So here are some simple exercises to help work on the stiff shoulder. Keep in mind that the key to regaining shoulder motion is gentle, persistent stretching. The arm is assisted to the point where it feels tight, then held there while the muscles are relaxed, and then pushing just a bit more to get a little bit more motion. The stretch should be held for at least a minute and to allow the muscles to relax. Relaxation is really the key. The stretching exercises should be carried out 5 times a day, and any discomfort from the stretch should go away after 20 minutes. Here are 4 exercises that we use to increase shoulder flexion. That is, raising the arm up to the front. Supine-assisted flexion, the table slide, the pulley, and the sideways lean. So this is supine active assisted flexion. So what happens here is the individual uses the opposite arm to power the treated arm and to take it to the point where it's tight. Again, focus on relaxing this arm, gently providing the power with the other arm. Take it to the point where it's tight, and then try to relax and get just a few more degrees each time. And usually, over time, a wonderful amount of motion can be regained. It's useful to track that motion by taking a photograph from the side. And here we can see this lady has done a great job of rehabbing her shoulder so that this angle is almost 180 degrees. Another very effective exercise for gaining flexion is the table slide. And in this exercise, the arm is slid forward, the stool is slid backward, and the patient leans on the arm, again applying a gentle stretching force. And holding that for up to a minute while focusing on relaxing the shoulder. The pulley is not a really effective stretching exercise, but it's a great warm-up exercise. And sometimes just repeated use of the pulley up and down gets that shoulder nice and lubricated. In the early phases when the shoulder is stiff, it can be useful for stretching, but as the patient gets further down the track, the other 2 exercises we've already discussed are probably going to be more powerful. The sideways lean is very similar to the forward lean or the table stretch. And here again, we're just trying to stretch the capsule that's underneath the shoulder. The patient secures the arm on a fixed object like this table here and leans the arm down, and the stool is slid a little bit away from the table to again increase this angle between the chest and the arm. Tight shoulders are often particularly tight in the back due to contracture of the posterior capsule. There are 3 exercises that are useful for stretching the back of the shoulder: crossbody adduction, the sleeper stretch, and up the back stretch. So crossbody is simply pulling the elbow of the affected arm across the front and holding it there while relaxing the muscles. Sleeper stretch is a difficult exercise for some people, but it's really a very, very effective one. So the arm is put straight out to the side as shown here. The patient leans a little bit toward the side and then uses the other arm to gently rotate the forearm down. So the goal here is to gain internal rotation of the arm in abduction with the arm out to the side, gently pushing this arm down toward the table or floor. And finally, we have the up the back stretch because this is an important one for regaining full motion of the shoulder. We can judge the success of this exercise by measuring how far up the back of the person the thumb can reach. The shoulder can be stretched by using a towel and grabbing it with the affected arm and pulling it up with the opposite arm. There are a couple exercises that can stretch the front of the shoulder. These exercises shouldn't be done soon after shoulder surgery without orders from the surgeon because they can jeopardize the reattachment of the subscapularis. So early on, we just encourage the patient to rotate the arm till it's straight ahead. We would call that 0 degrees of external rotation. And we don't want to stretch beyond that point, knowing that we can get that motion later. As the shoulder progresses and as that tendon is healed, we can use the opposite hand to power the treated arm into external rotation, keeping the elbow at the side. Now let's move on to strengthening exercises. And the goal of these exercises is to gently fatigue the shoulder and then give it time to recover completely before the next strengthening session. So we like to start out with something easy, like squeezing an elastic ball. That sort of gets the muscles going and also can help reduce swelling of the arm after surgery. One of the most important exercises is what we call the progressive supine press, which is specifically designed to strengthen the deltoid. It's a very straightforward series of exercises, but is terrifically successful. So the patient lies flat on the back, puts the two hands really close together, and does essentially a bench press, pushing the two hands up off the chest toward the ceiling. By keeping the hands close together, the opposite hand helps the treated arm getting into the proper position. As the treated arm gets stronger, then the two hands can be put further apart, as shown in B here. So we've got the two hands being separated, and so they are working more independently. When that is easy for the patient to do, and by easy we mean the patient can do 20 repetitions without any problem, we then advance them to a single hand push-up using a light weight, starting with the elbow bent and pushing the arm straight up toward the ceiling. When that can be accomplished with 1 pound, that's about a pint of water in a plastic water bottle. When that can be accomplished 20 times, then the patient sits up just a little bit and pushes again up toward the ceiling. And then when that can be done 20 times, then the patient sets up a little bit more and a little bit more until we get to the point where the patient can raise the arm up in a standing position. It's also important to strengthen the shoulder blade muscles, and there are 2 exercises that are helpful for this. One is the shoulder shrug. It's simple. You just hold a weight in the hand and lift the shoulder up. And the other is pressing up with the shoulder blade. So with a light weight held in the hand, the shoulder is pushed up to the ceiling using the shoulder blade motion on the body. Other strengthening exercises that are helpful is rowing, using the Latissimus Pull, and then selective strengthening of external rotation using isometrics against a fixed object, or elastic tubes, or weighted curls, and similarly internal rotator strengthening using isometrics, flexible tubing, or internal rotation curls. Again, these strengthening exercises, particularly these last 2, need to be done very carefully and slowly, slow progression, so as not jeopardize the tendons or any tendon repair, and should be done only on specific orders from a physician. So that concludes our shoulder rehabilitation program. Thank you very much.